this is Dr. Emma Hitt-Nichols, and this is the latest episode of the new FDA approvals podcast for the week of February 26th through March 1st, 2024. First up this week, the FDA has approved Amivantamab, also called Rybrevant, in combination with chemotherapy, carboplatin-pemetrexed, for the first-line treatment of patients with NSCLC, that's locally advanced or metastatic non-small cell lung cancer, with epidermal growth factor receptor, EGFR, exon 20 insertion mutations as detected by an FDA-approved test. This approval converts the May 2021 accelerated approval of Amivantamab to its full approval. The approval was based on the results from the phase 3 Papillon study, which demonstrated that Amivantamab plus chemotherapy reduced the risk of disease progression or death by 61% versus chemotherapy alone in patients who previously untreated NSCLC with EGFR exon 20 insertion mutations. EGFR exon 20 insertion mutations in NSCLC patients generally result in limited benefits from current third-generation EGFR tyrosine kinase inhibitors and chemotherapy, carrying a worse prognosis and shorter survival rates compared to lung cancer driven by other EGFR driver mutations. This targeted approach is the first approved for the first-line treatment of NSCLC with EGFR exon 20 insertion mutations. The FDA granted the approval of Amivantamab to Johnson & Johnson. Also last week, the FDA has approved the AGENT drug-coated balloon, DCB, for coronary in-stent restenosis, ISR, in patients with coronary artery disease, marking the first drug-coated coronary balloon to receive approval in the U.S. This device provides an alternative treatment for ISR, aiming to minimize recurrence risk. The AGENT DCB employs a paclitaxel-coated balloon catheter, delivering a therapeutic drug dose to the vessel wall. ISR affects approximately 10% of percutaneous coronary interventions, PCIs, in the U.S. The FDA's approval was based on positive results from the AGENT IDE trial, which enrolled 600 patients at 40 U.S. sites. A pre-specified interim analysis of the initial 480 patients showed the AGENT DCB's statistical superiority to uncoated balloon angioplasty in reducing target lesion failure at 12 months. The trial also reported no definite or probable stent thrombosis and a significant decrease in the risk of myocardial infarction at the target vessel, along with low adverse event rates. Boston Scientific Corporation, which has granted approval of the AGENT DCB, states the device will be available in the U.S. in the next few months. Also last week, the FDA has approved an update to the Ibrutinib, that's also called Imbruvica, label, introducing an oral suspension formulation for its existing indications, including chronic lymphocytic leukemia, CLL, small lymphocytic lymphoma, SSL, Waldenstrom's macroglobulinemia, and chronic graft versus host disease after failure of systemic therapy. This marks the first time Ibrutinib's tyrosine kinase BTK inhibitor is available in an oral suspension form, catering to patients with difficulty swallowing pills. Ibrutinib was initially approved in 2013 for mantle cell lymphoma in patients who had undergone at least one prior therapy. The oral suspension aims to simplify treatment for about 5% of patients facing challenges with pill swallowing. The approval of the Ibrutinib oral suspension formulation was granted to Johnson & Johnson in collaboration with Pharmacyclics LLC, an AbbVie company. Also last week, the FDA has approved Epcoritamab, BYSP, also called Epkinly, for adult patients with relapsed or refractory follicular lymphoma after 2 or more lines of therapy. This approval follows the agent's previous authorization for treating relapsed or refractory third-line diffuse large B-cell lymphoma, DLBCL, establishing it as the first and only subcutaneously administered bispecific antibody for this patient group. The mechanism of action of epcoritamab involves binding to CD3 on T cells and CD20 on B cells, inducing T cell-mediated killing of CD20 positive cells. The FDA's decision was based on findings from the phase 1/2 EPCOR NH1 trial in patients with relapsed or refractory follicular lymphoma. AbbVie and Genmab are co-developing epcoritamab, with both companies sharing commercial responsibilities in the US and Japan. AbbVie is responsible for further global commercialization. And now a word from the supporter of this podcast, Nascent Medical. Attention all businesses in need of exceptional medical writing support. Nascent Medical is the solution. We are a team of skilled MD and PhD level medical writers who specialize in fast turnaround needs assessments, manuscripts, slide decks, AdWord summaries, and much, much more. Don't settle for anything less than excellence when it comes to your medical writing assistance. Visit nascentmc.com. That's nascentmc.com. We're here so that you never have to be without excellent medical writing help. Also this week, the FDA has accepted the new drug application, NDA, for govorestat, AT007. That's a treatment for classic galactosemia, and granted this agent priority review. As a novel aldose reductase inhibitor, govorestat has shown potential in reducing galactitol levels and enhancing clinical outcomes among pediatric patients. This NDA is based on findings from the phase 3 ACTION Galactosemia Kids study, among other studies. Upon approval, govorestat will be the first treatment of its kind for galactosemia. The manufacturer, Applied Therapeutics, states a PDUFA target action date of August 28th, 2024. Also last week, the FDA has accepted a supplemental new drug application for obeticholic acid, also called Ocaliva, for the treatment of individuals with primary biliary cholangitis, PBC. Initially receiving accelerated approval in 2016, obeticholic acid is indicated for adult patients with PBC who are either without cirrhosis or have compensated cirrhosis and lack evidence of portal hypertension. This agent may be used in conjunction with ursodeoxycholic acid, UDCA, if the response to UDCA is inadequate, or as monotherapy in patients who are intolerant to UDCA. The supplemental new drug application includes data from post-marketing studies, COBALT, and Study 401, supplemented by real-world evidence from a U.S. claims database and international PBC patient registries. These confirmed clinical benefits in PBC patients. PBC is a rare and progressive autoimmune liver disease predominantly affecting women over 40 and can result in bile acid accumulation in the liver, leading to inflammation and fibrosis. Without intervention, the disease may progress to cirrhosis and necessitate a liver transplant or lead to death. Obeticholic acid's mechanism of action involves modulating the farnesoid X receptor, FXR, a critical regulator of bile acid, inflammatory, fibrotic, and metabolic pathways. The FDA's review will include an advisory committee meeting with the PDUFA target action date set for October 15th, 2024. Intercept Pharmaceuticals has been granted the approval of obeticholic acid. Also last week, the FDA has approved an expanded indication for Biktarvy. That's a combination of bictegravir, emtricitabine, and tenofovir for the treatment of patients with HIV who have suppressed viral loads and are dealing with known or suspected M184VI resistance. That's a common form of treatment resistance. Biktarvy is an integrase strand transfer inhibitor, INSTI, based single tablet regimen, STR, first approved in 2018. The latest approval was based on 48-week data from Study 4030, a phase 3 randomized double-blind study focusing on virologically suppressed adults with HIV on a baseline regimen. Participants in this study were randomized to switch to Biktarvy or continue with their baseline regimen. Biktarvy is manufactured by Gilead Sciences. Also, last week, the FDA rejected the new drug application for Minerva Neurosciences roluperidone, which has been proposed to treat the negative symptoms of schizophrenia. While one study did show statistical significance, the FDA said, among other things, in a complete response letter, that the study was insufficient on its own to provide substantial evidence of effectiveness. Roluperidone has been shown to block serotonin, sigma, and alpha adrenergic receptors involved in the regulation of brain functions, including mood, cognition, sleep, and anxiety. Minerva has stated that they will request a meeting to discuss the issues raised. All right, that's it for this week. I did want you to check out my free course, ChatGPT for medical writers and editors. Even if you're not a medical writer, if you're even in the industry, this will be helpful if you ever have to write anything. So do check it out. A few useful tips. It's really short, like 20 minutes, but has a lot of bang for the buck for its time, and it's free. So check it out at learnamastyle.com. That's learnamastyle.com. All right, thanks. Have a wonderful week, and hopefully you will come back next Monday. And do please tell your friends and colleagues, well, at least your colleagues, about this podcast. Your friends, maybe, I don't know if they'll be interested in this, but your colleagues, please tell your colleagues. All right, have a great week. Thank you.